Good morning, everyone.
Good morning, sir.
Very good. So, now today we'll be discussing something about little cytology, okay? So, this is applied pathology classes what we are conducting. I think most of your syllabus or your courses is over. So, what we are covering is some applied aspects which will help you to understand what are the applications of pathology, how we apply them in day-to-day life or in our practice, okay? Do you have any idea about cytology? Like, what is cytology? Anybody? What is histopathology? Come on, man, you people have already completed a path. I think you will be going for your exams. No, what is histopathology? Study of tissue. Cytology is study of cells. Okay. Similarly, hematology is study of blood. Okay, blood cells. So all these subjects are together. They come under pathology, and there are different subdivisions that we specialize so that the quality of service can be better. Okay. So in this particular class, we will be talking only about cytology processing. Okay, cytological samples and cytology processing. Do you have any idea what are the different cytological samples we get? Cytological samples. Any idea? Any of you? Any of you? What are the different cytological samples we get? You understand what I'm saying? That's a huge problem. If you are not interested in it, you should not come to the class, no? Attendance is marked right now. People who are not interested can leave the class and go. Please. But if you are interested, please sit in the class and listen to what we are saying. What are the psychological samples? Our gadgets are becoming smarter and we are becoming more idiots. You understand? If somebody says what is cytology, study of tissue, that means that fellow is an idiot. After 1.5 years of teaching you what is pathology, and if you say study of tissue is called as cytology, now only I told study of cells is called as cytology. Study of tissue is called as histopathology. Study of blood cells is called as, very good. So hematology is study of blood cells. Okay. So in this session, anybody knows what are like cytological samples? I was asking, sir, any idea about cytological samples? Lymph node aspirates. Is it correct? Is it correct? Yes. FNAC is one of the model of cytology. FNAC, fine needle aspiration cytology. Whenever there is a swelling in the body anywhere, we put a needle into the swelling, we aspirate some cells, we make a smear and we study those cells. That is called as cytology. That is one form of cytology. That is called as fine needle aspiration cytology. Can you name some sites where this FNAC is useful? Madam, any sites where FNAC can be useful?
Lymph node.
Very good. Any other that we told?
Thyroid.
Thyroid, very good. Any other site?
Bone marrow.
Yes, bone marrow aspirations also we do. Bone marrow study is also study of cells. It's a study of cells. Bone marrow aspiration is also a form of cytology. Anything else? Any other site? Any swelling, for that matter, any swelling in the body can be subjected to cytology, starting from your superficial swellings in the parotid, your lymph nodes, your breast tissue, subcutaneous tissues, to viscera like testis, ovary, liver, spleen, kidney. Wherever there is a lesion, you can do a fine needle aspiration cytology. Okay. Fine needle aspiration cytology is an easy modality as compared to histopath, because in histopath you will have to take a biopsy, whereas here it is easy to put a needle and take out some cells. Whereas in histopath you have to anesthetize the patient. To take a biopsy, first you have to anesthetize the patient and then you will have to take a biopsy. Okay. And that involves a biopsy gun, the biopsy needle, so that is a little costly affair. Okay. A biopsy gun comes for around 2,500 to 3,000 rupees. Okay. So that is a little costly affair. So FNAC is much easier, easily approachable, lesser risk. Turnaround time is very very soon you can have the report. Suppose you do FNC in the morning and the processing takes 4 to 5 hours, by evening you can have a report. Whereas in histopathology it takes a longer time, takes around minimum of 2 to 3 days. Minimum of 2 to 3 days. If it is a small biopsy, if it is a resection specimen, it takes even longer than that, maybe 5 to 6 days to have your report. So FNC is a much easier modality. Any other modality? Any other modality? One is FNC. Any other? Any other? Pap smear. Okay, very good. Pap smear. What is pap smear used for? What is the indication of a pap smear? Screening of? Very good. Screening of cervical cancer. So in which age group pap smear is done? In the reproductive age group. Very good. Some people are at least responsive. So this is not a totally dead class. So it is done in the reproductive age group to screen. Remember, never say diagnose. It is used for screening. So first we will take a smear. We will take some material from the cervix and then we will make a smear. We will see how it is being taken. And then what we will do? Then we will study the cells we will stain the smear and we will see what are the cells. From that, we can identify what are the different abnormalities in the cell, right? So we can pick up all kind of dysplasias or cytological abnormalities with the help of a pap smear. What is this for? Just like that. Clean your face. Not seen in the morning. Did you brush your teeth? Brushed them. Doesn't seem like. So we can forget to brush our teeth, but we will not forget to switch on our mobile in the morning when we get up. So that is the sad part. Anyway, cervical cytology is used for screening cervical smear. Remember, for screening. It is not for diagnosis. And whenever we report any abnormality in the cervical smear, then what has to be done? What is the next step? What is the next step? If a cervical smear is reported as abnormal or I report something as abnormal, what will be the next step? What will be done? DNA test. Why will we do a DNA test? What is done next? What has to be done? This is a screening method. We will screen. Then what has to be done, sir? After that, what can we do? For confirmation, what can we do? Biopsy has to be done. So a cervical biopsy has to be taken for confirmation whether there is really dysplasia or not, what we have reported in cytology, right? In addition to that, one more testing is required. Can anybody tell what testing is done in the cytological material? What is the etiology of some? Human papillomavirus. Very good. Human papillomavirus. You know the strains? Yes, they are called as high risk strains. Very good. So now why we need to screen this? Most of the ladies, you have learnt in the FGT chapter that all females will acquire HPV during the early reproductive life. But our body takes care of it. Our body immunity takes care of it. Okay. But in patients in whom there is a persistence means you will repeatedly screen and the patient is positive for HRHPV, those people are more at risk of developing cervical carcinoma. So this is another model of screening. So we do a cervical cytology as well as HPV screening. You understood what I am saying? So we do a cervical cytology as well as a HPV screening. Clear? So these two things are important, and HPV screening is especially important because it is a more sensitive method as compared to cytology. HPV screening is a more sensitive method. But if we do both together, that we do cytology as well as HPV screening, that serves as a more sensitive. But together they are more sensitive as compared to any of the single method. Hope I am clear? Yes. Then these are two modalities. One is FNC. Sir, what is the full form of FNC? Very good. Fine needle aspiration cytology. The other is called as cervical screening, that is through pap test or cervical smears. Can somebody tell what is the third modality what we have in cytology? What type of samples we can receive? For example, I tell you, a 60-year female comes with ascites. Okay, Or say a 50-year or a 45-year-old patient comes with pleural effusion, then what will be the next modality? And a malignancy is suspected. So what can be done now? Ascitic fluid tap or pleural fluid tapping can be done. Then what will you do? That can be subjected for cytology. Any other? A patient complains of drowsiness, young male complains of drowsy net rigidity, loss of consciousness. What is the suspicion? Meningitis. So what will you do? CSF tapping, right? And what will you do with the sample? What will you do with the sample? So you will send it for different examinations, right? What are the examinations CSF is subjected to? Microbiology, biochemistry, and cytology, right? In biochemistry, you can know the parameters, that the glucose and proteins, whether they are increased, decreased, all that. And in cytology, you will know what is the cell or whether a malignancy. Sometimes even metastasis can happen, which can be picked up from CSF. I hope I am clear. So similarly, fluid tapping can be done. All kind of body fluids, starting from pleural to peritoneal to ascitic to synovial fluid. So anywhere a subject abnormality is suspected, like say for example, a patient has arthritis and has a swollen knee, okay? There is a effusion. So the effusion can be tapped and subjected for cytology. Can you tell some form of arthritis? Anybody? Arthritis, any type of arthritis? Anything that you remember, anything, any arthritis? Sir, any arthritis? Osteoarthritis is a immunological or degenerative or like inflammatory. What type of arthritis? Degenerative. Any other type of arthritis? Rheumatoid arthritis, very good. Any other? Gout, very good. Any other? Sir, any other? What is that? The joint, very good. Remember, don't differentiate between osteomyelitis and arthritis. Arthritis is inflammation of joint, whereas osteomyelitis is inflammation of bone. Very good. TB, very good. Tuberculosis, that is again another bacterial arthritis. Okay, so arthritis can be septic arthritis, which is because of bacterial infection. So arthritis can be because of metabolic diseases like uric acid abnormalities, or you can have gout as a metabolic. You can have arthritis because of autoimmune conditions like SLE, rheumatoid arthritis. These are autoimmune conditions. You can have arthritis because of reactive conditions like a patient has a sore throat and then develops arthritis. What is that arthritis called as? A young kid develops sore throat, after that develops arthritis. What is that arthritis called? What is the specific disease under which like this patient can have? Example, very simple. Young fellow, sore throat, kidney problem can also be there. Rheumatic fever. So that is called as rheumatic fever. In rheumatic fever, what are the symptoms? What are the cardinal symptoms? In rheumatic fever, what are the cardinal symptoms? Migratory polyarthritis, very good. He told migratory polyarthritis. So that arthritis will not be fixed. That arthritis will keep on fluctuating. One joint, smaller joint, another joint. So all kind of joint are involved. So that is called as migratory polyarthritis. Okay. So that is another type of arthritis reactive. Or even after gastrointestinal tract infections, urinary tract infections, there can be arthritis or inflammation of the joint. That is called as reactive arthritis. Reactive arthritis. Okay. So now suppose a fellow is suspected of gout. What can you do? Or a joint inflammation is there and a gout is suspected. What can you do? You have to take a, how will you demonstrate? You have to demonstrate uric acid crystals, right? How to demonstrate uric acid crystals? You have to tap the fluid first. You have to tap the fluid and then send it for cytological evaluation. In the cytology, we make a smear or a wet mount and then we will, what microscopy is used? What microscopy is used to demonstrate these crystals? Sorry? Go on, please tell. Tell. not fluorescent microscopic, it is polarizing microscopy. Okay, fluorescent microscopy is different, polarizing microscopy is different. Fluorescent microscopy is for IF, like in kidney biopsies, skin biopsies, whereas polarizing microscopy we are using for the purpose of demonstration of these crystals. Any other condition where we use a polarizing microscopy? Amyloidosis, very good. You will find apple green birefringence in case of amyloidosis. Okay, so now we have seen three modalities in cytology itself. One is, what are the three modalities in cytology? One is FNSV, second is pap smear, third is fluid aspiration, okay, or body fluids examination, okay. So these are three modalities that are common. So Dr. Vardhini, our SRC will cover how we process the samples. In case you have doubt, please feel free to ask, okay.
Good morning. After these three subdivisions, we will be seeing what kind of samples we receive in our cytology lab and how it is being processed in our cytology lab, and final how the slides are released. Okay. So as sir said, these are the major three subdivisions of cytology. One is exfoliative cytology, that is effusions, and final aspiration cytology. The third one is pap smear. So once we receive sample in our laboratory, so from the clinical side, they will raise the investigation request. They will check the patient's details, patient's hospital number, patient's age. Then they will generate a request ID based on the clinical information they will give. So this is how we receive sample in our cytology lab. Like once sample is received, they will stick the request ID on the sample. Like meaning the patient from the clinical side, they will raise the request ID and they will stick on the sample side. So what we will do in our laboratory is first we will check the details on the barcode using, this is online based. So with the request ID we will put all these details in the online form. Then we will generate a lab ID. Once lab ID is generated, that lab ID will stick onto this sample. Then we will label the samples with the lab ID and further process in our lab. So individual samples will have an individual lab ID. No name will be disclosed in the sample. Okay, understood. So once request ID we receive, we will generate a lab ID based on the request ID, and each individual samples will have a separate lab ID for each individual samples. Later all these samples will be processed. Okay. So what all samples you will receive under non-gynecological samples, like one sir said pleural fluid, what all samples you can receive? CSF then, ascitic fluid then, synovial fluid then. Urine sample also we can receive. Okay. So these are the different kinds of exfoliative cytology samples which we will receive in our laboratory, of which one which is highlighted in red is very much important. Okay. Once immediately you tap the CSF, you should bring immediately to the laboratory because the chance of degeneration is very high. Okay. So once immediately procedure is done, you should bring these three samples immediately to the laboratory so that processing will be initiated faster and the further slides will be provided. Okay. So if we delay in bringing these samples to the laboratory, chance of degeneration will be higher and microscopy will not be good in these cases. So interpretation also will be difficult. So these three samples should be immediately brought to the laboratory and should be processed within 1 to 2 hours. So these other three samples like pleural fluid, ascitic fluid, peritoneal washings, for example, in case of staging laparotomy, if patient is having ovarian malignancy, if they are doing the procedure, they will wash the peritoneum to look for upstaging of the tumor. So in these cases like bronchial brushings and bronchial washings, all these samples, maximum it can be delayed for 1 day, 1 or 2 days if it is kept in the refrigerator, not inside the deep freezer. In the door of the refrigerator, if it is kept, it can be kept maximum for 1 to 2 days and processing can be done with 1 to 2 days. The most important among these samples, the first three samples, which should be immediately brought to the laboratory. So all this if you keep in mind when you are becoming an intern. Okay, when the procedure, CSF procedure or a urine sample or in this bile fluid, once it is taken from the patient, it should be immediately given to the laboratory without any delay. Because chance of the degeneration is very higher in this case and diagnosis will be difficult.
So what will happen if you are sleeping in the class, you know? Recently one CSF tapping was done on Friday. On Friday the CSF tapping was done and the CSF sample came to the pathology laboratory on Monday morning. You understand? So that will happen if you are sleeping in the class. That is all I can say. You understand what I am saying? So all samples are to be treated as urgent and they have to be sent to the respective labs as soon as possible. And if they have to be preserved, they have to be preserved in the fridge. Maximum like say 12 to 14 hours you can keep them, and don't freeze them, just keep them in the door and you can submit them next day morning. In case you are tapping at night. But preferably the tapping should be done ideally in the morning and it should be subjected to the lab as soon as possible. Okay, so that otherwise the cells will degenerate.
So this is the reason for why we have to give immediately CSF, because it will have a low mucus and protein content, so chance of degeneration will be higher, preservation of the material will not be there. Whereas in sputum and effusion will have high mucus and protein content, so some amount of preservation of cells will be present. And gastric aspirate is immediately we should process because it will have a very low pH, so once it is taken out from the body it will die immediately. So it should be immediately processed and it should be given to the laboratory very fast. So this is how we will receive the sample. In these containers, you should not bring in a saline bottle also. It should be a closed sterile container.
So
Okay.
which is likely to be a more pathological sample among the three? Which is likely to be a more pathological sample among the three? Third one, right? Why? Hemorrhagic samples are almost always abnormal. You don't get hemorrhaging transudate. Okay, there is a fluid are called as transudate and exudate, right? Fluids are called as transudate and exudate. Transudates will be clear, whereas exudate is because of inflammation and neoplasms, right? So if you have a hemorrhagic effusion, it is more likely to be abnormal. So among the three samples, the right one is more likely to be abnormal. I am not saying it is abnormal, more likely. And how we can confirm it? We will have to examine the smears. Once we examine the smears, if abnormal cells are detected, then it can be confirmed as abnormal or pathological.
So once we receive these kind of samples in our laboratory, first you have to check the patient's details and generate a lab ID for these individual samples. Then we have to cross-examine the sample. How is the fluid? How many ml of fluid? Volume of the fluid is important. So we have to mention how much ml of fluid we receive. So ideally it is around 30 to 50 ml is ideal for a cytological examination. In CSF it is fine. Whereas in pleural fluid, 1 ml is also fine in CSF. Whereas in other fluids like cytic fluid or pleural fluid, it is minimum 30 ml is required. If it is less ml of fluid if we receive, chance of cell shedding into the pleural fluid or ascitic fluid will be lesser. So more amount of fluid is required generally for a good cytological examination. Then you have to look at the color of the fluid. So whether it is clear or turbid or hemorrhagic or yellow, straw colored, all those are important. Okay. So gross examination of fluid is important and volume of the fluid is also important. Once we confirm the patient sample and generated a lab ID, after gross examination, we have to centrifuge all these fluids to get a sediment. From the sediment only we will make a smear, then we will stain and see under microscope. Okay. So there are two different centrifuges we have in our laboratory. The first one is Remy centrifuge and this is aerosol type centrifuge. So in COVID times and all, when we are centrifuging, there is generation of aerosols which will contaminate us also. So to prevent that, airtight containers we have used, like so this is our airtight containers. Inside this we will keep this plastic tubes. Okay. So these are we will pour this sample inside the plastic tube and keep in the refrigerator for 2000 RPM for 5 minutes. Okay, once centrifuge is done, the sediment will settle at the bottom. Then we will take from pipette the sediment and smear it and then stain under auto stainers and NTT stains and we'll see under microscope.
So after centrifugation, this is the palette. Then after centrifugation, this is the palette.
So once centrifugation has been done with the 2000 RPM for 5 minutes, the sediment will settle at the bottom, that is called as pellet. So that pellet we will take by using a pipette, then we will put in the slide, then we will smear it, then we will stain and see under microscope. So this is a general procedure for all effusion fluids. Suppose when the fluid is very clear, we will not be able to see the sediment, then one more centrifuge we will use, that is called as cytocentrifuge. So this centrifuge will have a plastic tube attached with a slide. So once centrifugation has been done, all the cells which are sedimenting at the bottom will put directly onto the slides. So we will put a circle around these areas and we will stain and see under microscope. Okay. So for turbid fluids, we will use this routine centrifuge. To prevent aerosol, we will have a airtight container centrifuge. For a clear fluids, we will use something called a cytocentrifuge, and CSF will be usually it will be clear. So all CSF samples are processed under this cytocentrifuge. It will have a slide along with the tube. So once this centrifugation has been done, the sediments will deposit directly over the slide so that you will stain and see under microscope.
So for MCQ purpose, you must remember that for processing CSF, we use cytocentrifuge. We do not use the routine centrifuge. We use a cytospin or cytocentrifuge. That there the smears will be directly formed to the slide. Okay, you will not know like she explained. If you want to remember, it's okay. But otherwise, you can just remember that for CSF, you can use a cytocentrifuge, not a routine centrifuge.
So this is our laminar airflow chamber. So while once the centrifugation has been done, we will open the plastic tube and then we will take the pipette. That time aerosol generation will be there. So all the infected samples, the person who is doing the procedure also may get infected. To prevent this laminar airflow chamber, this will take the air from the aerosol areas and will go to the filter and filter it out from the chamber. So this is which we are using in our laboratory, this steel force laminar airflow chamber. So this is our technician who is, there will be a glass stage will be there, behind that patient, the technician will be sitting and that side.
Okay, so the air will go this way, air cannot come out of it. Air will go this way and air will be pulled up, shut down. So whatever infective organisms are there in the air, whatever is the sample, that will be going out of the lab, that will not be coming back. Okay, that is how the infection can be prevented.
So she will be sitting here and this is the glass stage or this there and the samples will be kept that side. Okay. Once the centrifugation has been done, this from this pellet she will pipette out the sample and the slides will be arranged and the lab ID which I told no, it will be written on the each slide. So particular sample will have a particular lab ID and all those IDs will be written on the slides. So the sample will be pipetted out and the one drop will be kept on these slides. Then she will make a smear. Then it is like 3 smears we will do. One is air dried smears, then is wet alcohol fixed smears. Then this fixators you have to, one is for pap stain and one is for MGG stains. Okay. So and 2 unstains we will keep. Totally we will make 5 smears. 2 is for unstained, we will fix in ethanol fixators. Then 1 is for just we will make a smear and keep it aside. That is called as air dried smears. 1 more we will smear it and put in fixators. Then we will do that is for different stains. So 2 stains we will do. One is MGG stains, May Grunwald Jimsa stain, and other is pap stain. One is for nuclear details and one is for cytoplasmic and other extracellular material enhancement.
So pap stain is for? Pap stain is for nuclear or cytoplasmic? Pap stain is for nuclear or cytoplasmic? Papanicolaou stain is for nuclear or cytoplasmic? For nuclear, remember. For Papanicolaou stain, alcohol fixed smears are used for Papanicolaou staining, which is better for nuclear details. Whereas air dried smears are stained with MGG, May Grunwald Jimsa or Lisman stain or whatever you can say. Different cytoplasmic stains are used, they are done on the air dried smears. So there are some differences between like MGG and PAP, but you must remember for nuclear detail, Papanicolaou stain and alcohol fixed smears should be used.
So these are the two, like one is auto stainer and one is manual staining. The auto stainer is for Papanicolaou stain and this manual staining is May Grunwald Jimsa stain. Okay, so this the final result will be, we will receive slides like this. So the one which is purple in color is MGG stain and one which is orangish and this color is PAP stain. So for better nuclear features we will do for PAP stain and also for ancillary studies like immunohistocytochemistry we will use this PAP stain. So that is about exfoliative cytology. So we will receive the samples, we'll check the patient's details, then centrifuge, take the sediment, smear it and put the stain and then see under microscope. So next modality is fine needle aspiration. So fine needle aspiration we will deal directly with the patients. So patients will have a FNAC clinic in the first floor of OPD building. So patients will come to us. First we will examine the patient where is the swelling. When there is an obvious swelling, we will perform a blind FNAC. When there is very small, for thyroid and all, if it is very less than 1 centimeter, if it is in millimeters, then ultrasound guided FNAC can be done. So these are our 2 own patients. Like patient is having here cervical region lymph node and lesion swelling, and here is a forearm swelling. So with this, these are the two patients. Then we will examine the patients. Any other slight swelling is there, and history also will be taken from the patient. Similarly, here also lab ID will be generated for like they will raise an online request, and request ID will be given to the patient. With the request ID, we will generate a lab ID for this particular patient. Then we will get the aspirate and stain it and see it. So this is how FNAC procedure has been done. So there will be an FNAC gun, 20 ml syringe will be there, and blue needle, a 22 gauge needle will be taken, and we will fix the swelling. Then we will insert inside the swelling and take a negative pressure, to and fro motion. We will take out the cells from the swelling. Then we will spread in the slides. Then we will similarly, one is for arbrate and one is for alcohol fixed solution. Then they will take the slides to our laboratory and stain it under auto stainer and manual staining and see under microscope. Okay, once the procedure is done, we will take out the needle from the swelling and we will keep the cotton to arrest the bleeding. Okay. Once it is done, the slides will be arranged like this in our in that area. We will push all the cells which are taken from the swelling. We will push all the slides into the slides like this. Okay. So then we will smear it. One we will give for arbrate and one we will give for wet fixed. Okay. Similarly, same procedure. So on the one which is fixed will be done in auto stainer for pap stain, and one is not fixed in arbrate will be done with MTG stain, and we will get the slides, final slides results. Okay. The last one is pap smear. So this is liquid based cytology. There are two different methods. One is conventional smear and one is liquid based cytology preparation. Conventional smear, they will immediately take the how they will do pap smear. What is the modality of doing clinical side? How they will do? Using which? Spatula. Any other modality of doing? Cyto brush can be used. So once it is this wooden spatula is IO spatulas, and cyto brush is inserting the bristles inside the endocervical canal and take the. So this is an alcohol based fixators which is normally provided by our company SurePath. There are two modalities for this liquid based cytology. One is SurePath and one is thin prep. Okay. So we are using SurePath based processing. So this will be given to the OPD side. One cyto is pressed. So that is a cyto brush. Okay. Once they insert inside the cervical wall, then they will take the smear and cut this brush inside this alcohol based fixators. And this alcohol based fixators they will bring to our laboratory and they will place the request ID also to the sample. Similarly, we will generate a lab ID for this. Then we will store, it can be stored at room temperature for around up to 4 weeks if it is 15 to 30 degrees Celsius. And in refrigerator it can be stored up to 6 months. Okay. So once sample is ready, there will be different methods of processing this cervical smear. So this is by SurePath liquid based cytology. So first thing what we have to make it ready is one is that pre-coated slide will be there. Then the settling chamber, then slide holder. Okay, so we'll arrange all these things. Like for example, that is a slide holder, then settling chamber and slides all will be arranged. Then different methods of processing I will tell you. So these three things should be kept ready for processing this liquid based cytology. This is for centrifugation. There are different methods. For SurePath, it is by sedimentation. We have to centrifuge and take the sediments and then place on the slide, then smear it, and pap stain is routinely used for this. Whereas in thin prep, it is by filtration dispersion method. Okay, by keeping the filter onto the sample, it will undergo dispersion. Then by negative section, all the cells will be stuck to the filter, and this filter is immediately placed onto the slide and stain it and see it in the microscope. So these are the two methods. One is SurePath PD and one is thin prep preparation. And conventional is directly will smear over the slide and fix it and then stain and see under microscope. So first we have to vortex the sample. Vortex is like once the sample we receive, cells will be, we have to disperse the cells through. So we have to vortex the sample. Then we have to place that sample inside the setting. So the first one is SurePath, the next one is thin prep. So in this, so we have to centrifuge, this sediment is there, this sediment you have to place inside the settling chamber, it will be there. Then we will put a density reagent which will rinse all the supernatant solutions and it will go out. So once after this, rinsing alcohol is used for clearing the supernatant. So all this is done, this cells will be deposited inside the slides, then we will stain and see under microscope. It is basically a sedimentation technique. First you have to vortex the sample to send the dispersed population of the cells. Then we have to centrifuge it to get the sediment of the sample. Then we have to put a density reagent and a rinsing alcohol to clear all the supernatant. Once the sediment will remain. That sediment will be deposited on the slides. Then you have to fix it and then you stain it and see under microscope. That is about sure path. Thin prep is you have to place a filter over the sample so that all the cells will be dispersed, and by negative section all the cells will be attached to this filter. And this filter you have to place directly onto the slide so that cells will stuck onto the slides. Then you have to fix it and then stain it and see it under microscope. Okay, one is methanol based fixators, one is ethanol based fixators. One requires sedimentation, other requires does not sedimentation. One is by sedimentation technique and other is by filtration. The advantages of this LPC over conventional is screening time will be very less. Only in the circle area we have to screen the cervical skin. If it is conventional, it will be present throughout. From here till here we have to screen the sample. Whereas in these two areas, only this area is limited for screening the sample. So that is the advantages of LPC over conventional smear. So previously we will be using conventional smear. Now we have switched on to LPC to prevent also background material will not be obscuring in case of LPC. Whereas in conventional, all the lubricants and all the hemorrhage or necrosis, all will be obscuring the cellular leak. So that will not be there in liquid-based cytology.
So, we have spoken a little bit about the processing of different body samples, but you must know a little bit about cervical cytology, because when you people become intern or clinicians, whichever department you specialize, but you will have to send samples. So it is very important as students, you must know which modality to send, when it is to be sent, where it is to be sent. Now many times it happens that you are supposed to send for cytological sample and you would have sent the sample to histopathology. Okay, there are different divisions. Similarly, many times what PGs and interns do, they will generate for FNSC, they don't know what is the difference between FNSC and biopsy. Okay, so when they want a FNSC, but they would have generated a request or lab ID under biopsy. So that should not be done. That is the importance of taking these applied pathology classes. You may think we are boring you, you may think whatever, like whatever you want, but most important thing is if you know when to send, where to send and how to send. That is a very important characteristic of a good clinician. You may become a good clinician, but if you can't send the sample properly, that means you are an idiot. You understand? And if you don't send the sample properly, that means that will not give you good results. Always remember that. So a good clinician will know where to send, how to send and when to send. Right? Now what a sample you are sending, where you are sending, that is very important. Now, a point or two about the cervical smears. Previously, what was done was conventional smears. Conventional, okay? With the IR spatula, they will just you know how the cells are shed, right? There is exfoliation. The cells will mature and the cells will shed, right? There is shedding. Every surface epithelium will shed cells. Similar changes happens in the cervix also, okay? So in the cervix, what happens? The basal cells are there. Then the cells will gradually mature and the cells will be shed. These are called as exfoliation. Exfoliation. That is why cervical cytology is also otherwise called as exfoliative cytology. Exfoliative. In FNSC it is not exfoliative. Cervical cytology is exfoliative because the cells are shedding. In FNSC what we are doing? Are we collecting shed cells? No, we are actively collecting cells. Okay. So these cells will be shed and with the help of IR spatula, we will take the material and make a smear. We showed you the conventional smear. This is how the smear will look like. Okay. This is how the conventional smear will look like. Such a big area. They will make a smear and then they will discard the IR spatula. So what will happen when you discard the IR spatula, some material will also go with the IR spatula. So there is a loss of material. That is why with evolution then came cytobrush. Cytobrush. He showed you one image, can you go back please? Then came the cytobrush, okay? Cytobrush, show them the cytobrush. So here the cytobrush will come. Next one. So the cytobrush, what happens? They will nicely twist it, and brush, what happens? No, bristles will be there. Just like toothbrush, we are using same brush. So when you insert the brush into the cervix, that will have a better collection. You see, this is the shape of the brush. This is the shape. This will go inside the os, the cervical os, okay? and these bristles we will be moving round and round. So at least 3 to 5 times clockwise or anti-clockwise it is twisted, and what will happen? They will detach it. This is detachable, okay? This is the stick which they will use to hold, and they will detach it. They will detach it and put this into this fluid. So what will happen? Is any material lost? Is any material lost? No. So all the collected material is going into the sample. You got my point? All the collected material is going into the sample. Then you will centrifuge it. But the limitations also you must remember. Which is more cumbersome, LBC or conventional? Which is more difficult to process? Which is more difficult to process? LBC or conventional? Conventional is much easy. So just make a smear, put it in alcohol. Remember, 95% ethanol. 95% ethanol. That frequently comes as an objective or MCQ in your entrance exams as well as MBBS. It is 95% ethanol. 95% ethyl alcohol or ethanol is used as a fixative. Okay. They will make the smear, put it in fixative, send it to us, we will stain it. That is all. Okay. Conventional. In LBC what they will do? They will take a brush, they will rotate it, they will detach the brush, put it in the fluid. The fluid has to be brought to the lab and it has to be processed in the lab. So which is more cumbersome? Which is more cumbersome? LBC is a more cumbersome procedure. LBC is a much costly procedure. That vial, that brush, and that comes for around 500 rupees per sample collection. 500 rupees. Whereas a conventional smear requires just one slide, one air spatula, disposable air spatula. That would come for around maybe say 20-30 rupees. 20-30 rupees. Okay. Previously air spatula were used. Nowadays disposable air spatulas are used. In fact, if you ask me off late, spatulas are no more used. You can use the brush. The process gives you better sampling. So better diagnostic capability. Okay. But though this LBC is costly, though it is a cumbersome method, why it is preferred? Can anyone say nowadays why it is preferred? It has got certain advantage also. What are the advantages? Why did this LBC come into the picture? I have already told you the thing. You just have to use little imagination. Why did the LBC come to the picture? Good morning, sir. This is sad. You understand what I am saying? This is sad. Very sad. So, anyways, it is your choice. All of you are adults here, no? 18 plus. Anybody below 18? Anybody below 18? Okay. So everybody is an adult. So you have got your choice whether you want to learn or you don't want to learn. That is your choice. We cannot force you to learn. But I would say if you learn these things, these are important. Why we are taking these extra classes? These extra classes are not taken in any other medical college. It is just to make you more like what you say. You know how the samples, where they have to be sent, how they have to be sent, which is the correct diagnostic modality to be used. That is why we are trying to take these extra classes so that you people are more acquainted with the methods. Okay? And so when you become interns or postgraduates, you are not idiots. Okay, you are better, you are confident, you are smarter. Okay, you will become interns after 3 to 4 years. So your gadgets would have become smarter, but you people would have become more idiots. Okay, if you don't listen in the class and sleep in the class, then like I gave you an example that the sample will be collected on Friday and submitted to the lab on Monday. Clear? You will not even know, as an intern, you will not even know what is the difference between cytology and histopathology. What is the difference between a biopsy and a FNSE? Clear? That is the reason that these classes, extra classes have been arranged. So we were talking about LBC. Now the greatest advantage of LBC is doing HPV testing. In conventional method, remember, we cannot use HPV testing or we cannot do a HPV testing. Whereas if you see this sample will contain the virus. This sample is an infective sample. This sample will contain the virus. So we will use some part of it for doing the smear. And the remaining amount of fluid will be used for the purpose of HPV testing. That is the advantage of LBC. Though LBC is costly, and if you see the smears, go to the smears. Just go ahead. So if you see the smear, which is a bigger area? This is a bigger area, this is a bigger area, this is a bigger area. Which is a bigger area? Conventional. So where screening is difficult? Conventional. You have to screen a lot of area. Okay? And there is a chance material may be lost. It will be in some corner. You would not have gone there. Okay? So some of you will join pathology also, will be pathology postgraduates. Okay? So when you become pathology postgraduates also, you will sleep in the class. Okay? You will not listen what is to be done, where is to be, slides has to be screened. I don't know. Any of you interested in pathology? Any of you? No one is interested to join path. All are interested to become clinicians. Then these classes are even more important. These classes are more important, but you people are sleeping. In these classes, we are not talking about diagnostic. We are talking about the modalities, how they have to be used, where they have to be used. Okay. So if you see this area I can screen the whole area, smaller area of screening. Here it is a much bigger area which is difficult to screen, takes a lot of time. Other thing, now suppose the problem is here. I have searched 99% of the area, but still I will miss the problem. I will miss the dysplastic cells. Okay, that is why smaller area of screening, better background, HPV testing. These are some advantage of using LBC. Understand? LBC is full form liquid-based cytology. Okay. So if you have to write a short note of PAP screening, then there are two modalities. One is conventional, one is LBC. Conventional, it is done everywhere. Even in villages it can be done. Even in PHC, CHC it can be done. PHC means, you know what is PHC? Sir? Primary health center in the periphery. Okay. Whereas this LBC is available only in advanced centers or little high-end centers, and it is little costly. Like I said, each method of LBC will cost you, or each testing of LBC will cost you around 400 to 500 rupees. Whereas a conventional testing will cost you only say 30 to 50 rupees. But this testing can bring down the burden, of cervical cancer. Why it can bring down? Why cervical screening can bring down the cervical cancer burden? Why it will bring down? Very good. Early detection, better management, better for the patient. If the patient is diagnosed in the stage of cancer, it is better. Or if a female is diagnosed in the case of dysplasia, is better. So she can be given the accurate, correct treatment, and she will not go into an invasive stage. Because once there is invasion, then there is a chance of metastasis and spread. And dysplasia is a very preliminary stage where a patient can be given early treatment and cure. Whereas in malignancy, it has to be a bigger surgery, chemotherapy have to be given, surgery, or you can say radiotherapy have to be given. So there are other complications also associated with invasive carcinoma. Okay, so this HPV can easily be detected and cervical cancer can easily be eradicated. Can it be eradicated? Sir, can cervical cancer be eradicated? Yes or no? Only two choices, yes or no? No. He says no. Does everybody agree with him? Can it be eradicated? Yes or no? There is some opinion you should have. India is a democratic country. Yes or no? See, I am not going to give you mark right now. You are not going to pass or fail. You should exercise your opinion. Yes or no? How it can be eradicated? With the help of? Very good. With the help of health. Vaccination. Now there is a vaccination available for HPV. So vaccination along with screening, along with early screening. So this vaccination have to be given in the you can say in the pre-pubertal girls or before the onset of sexual activity. The vaccines have to be given as well as early screening. These methods, if they are used, there is a chance that we might bring down the burden of cervical cancer. Clear? Not just cervical cancer, HPV is also associated with many other malignancies. Any idea, sir? Any other malignancy where HPV is associated? Not interested? When patient will come, you will say, I don't know, sir. Fees, but you would have already taken. What will you do? You will refer them to your friend. Huh? Any other disease caused by HPV? Squamous cell carcinoma of penis. Very good, excellent. Squamous cell carcinoma of penis. Okay. So carcinoma cervix only one cause, that is HPV. Rather, that is the cause for 99% cases of squamous cell carcinoma of cervix. Whereas in penis, also like HPV is associated. That is why in the recent WHO classification, if you see, squamous cell carcinoma is categorized into HPV related squamous cell carcinoma and non-HPV related squamous cell carcinoma. If you read the recent updates, then you will be able to know that it is caused by HPV related or non-HPV related. In carcinoma penis, HPV related is less incidence, only say 30-40% cases. Whereas in carcinoma cervix, HPV causes more than 95 to 96% cases of carcinoma cervix. Okay. In addition to that, any other site? Any other site? 2 minutes. Very good. Oropharyngeal malignancies. Again, it can cause oropharyngeal malignancies also. So, in oropharynx also, now the classification says HPV induced and non-HPV induced. That is very important to know. So, not just these diseases, there are many oral cavities, oropharyngeal, carcinoma penis, carcinoma, any other site? Any other site? Sir? HPV. We discussed about oral cavity. Very good, anal canal, that is another site, okay? So carcinoma penis, carcinoma cervix, carcinoma anal canal, carcinoma oral cavity, carcinoma oropharyngeal. So just imagine HPV causes so many malignancies, and one vaccination can prevent so many diseases. One vaccination can prevent so many diseases. Good morning, ma'am. So name the malignancies that are caused by HPV.
Cell carcinoma, oropharyngeal, and carcinoma.
Any other? Your choice. Adult learning is voluntary, okay? So, sir, you have something to share? Middle one, last one, middle one. You have something to share, something interesting, some joke? Already people are so serious, you can share something with them. There is no bravery in sitting in the crowd and making mockery. You understand what I am saying? There is no bravery in that. Bravery is there when you stand here and you teach. When you stand up and you have the guts to say or share your knowledge with the class. That is where bravery is there. Not just sitting in a bunch of 180 and me in the backside and gossiping something and making fun. Okay, so whatever I shared, you must know a little bit about the cytological processing. So briefly, I will summarize the class. We have learnt about fluid cytology, we have learnt about FNSE, and we have learnt about cervical cytology. So you must make sure that you send the sample as soon as possible. It should be sent to the lab as soon as possible. And remember, FNSE is not same as biopsy. There are quite a differences between FNSE and biopsy. You can read about them from various textbooks. And so cytology is a much rapid, faster and easier method of sampling and for categorizing or triage of lesions. Third, we learnt about cervical cytology, the type methods of collection as well as the methods of processing. By doing a cervical smear or a routine cervical testing, we can prevent, or what we can say, we can prevent the invasive carcinomas. We can detect malignancies or cervical abnormalities or dysplastic cells at a much earlier stage or in a pre-invasive stage, which is better for the patients. In addition to that, we learned some diseases that are caused by human papilloma virus. I hope this class is useful. Thank you so much.
Mula Bhaskar, Mohammed Shamil.
See, just 1 minute. Just 1 minute. When I was taking the class, I was asking questions, no voice, no sound. You see, the moment I keep down the mic, that a buzzing sound comes, especially from the last benches. Very happy. I wish I have a chance to take your exams. I wish and pray that I have a chance to take your exams, or I have one of the internals to take your exams. And that time it will be 1:1. It will not be 180 versus 1. It will be nice 1:1. And then who will be smiling? I hope all of you know the answer. Right? But only problem, the fun part is that we cannot fail you. That is the fun part. That is the sad part. I always keep telling, we cannot fail you. Even if we want to fail you, we cannot fail you. You understand? In private medical college, even if it is worse, it is even worse. Even if people don't open, you saw a thyroid specimen, you ask them what is it? Sir, lung. Okay, 5 marks. Okay, you saw them a heart specimen and what is this? Sir, kidney. Very good. Understand? 5. So you ask them what is pneumonia? Sir, collection of fluid in the lung. Very good. Then you ask what is effusion? Sir, I don't know. You understand? So this is the real state. Anyway, you people are little better than them. So there is no way of telling you. We would love to, but we can't because again dean will complain, director will complain, you people will go on strike that they failed us, I answered all the questions. So I think a better method of assessment will be, we have a camera recording. You understand? When the viva happens, we should record the answers that you are giving and those answers should be displayed in the subsequent junior batches. That will happen. Okay? Because when I was also undergraduate, I will tell you the joke. I used to go inside the viva and my teacher will ask me suppose 20 questions and I would have answered only 2. And those 2 also will be wrong. Okay? And when I come out, my friends will ask, how did you do? Oh, so brilliant. So brilliant. Extremely brilliant. I answered all the questions. Almost 18 questions I answered. But my friends will be, oh, this fellow is a real brilliant fellow. Okay? But when the mark comes out, I am just 51 out of 100. Okay, then my friends will like, hey, what happened? That sir is not good. That sir is not good. You understand? He will give only mark to the girls. He will not give mark to the girls. Understand? So, and if it is a lady, oh, that madam, old madam was not good. She will not listen to my answers. I answered everything correctly. She has not read the recent version of Robbins. What happened? No, I answered all definitions from recent version, okay. But that madam has not read the recent version of Robbins. You know recent version means what? He would not have read the book. You understand? That is what was our state of affairs. So nothing different, but what I would tell you is that competition is increasing day by day, life is becoming more difficult day by day, more number of medical legal cases are happening day by day. When I was an MBBS student, life was much easier, now life has become much difficult. You people don't realize, you think gadgets are making life easier, but they are making life more difficult. You will realize it slowly, but that is what I would say to conclude this class, that you have to be smarter than your gadgets. You have to be smarter than your gadgets. Your gadgets cannot decide what is to be done. Nowadays robotic surgeries have come. Do you know robotic surgeries? Have you heard of it? Okay. They will help you. They will not do the... Who will operate it? Who will operate those robots? Who will have to operate? We have to operate, no? The surgeon has to operate. So who has to decide where the robot will do, what the robot will do? The surgeon, no. But if the surgeon is an idiot, like a sleeping resident in the class, he doesn't know which button to press and you press the wrong button, then what will happen? Do you think a training program, if you are sleeping, then what will happen? You are understanding? No, the sad part, what you know, the bottom line. You people think that always the patient is going to be on the other side, but you don't think that someday you may also be the patient. You agree, no? Suppose someday you go to a hospital and one fellow is a doctor there who has passed from a private medical college, who identified thyroid as lung specimen. So what will happen to you or your relative? What will happen? Very good treatment? Yes or no? Very good treatment? Super treatment will be given. Super treatment, okay? You would have gone for a thyroid problem and your lung will be out. Or you would have gone for a prostate problem, your kidney would be out. Okay, so with that I'll end this class. So be serious and be attentive in the class. Thank you so much.